Welcome to the Hustle Baby Podcast, where I give entrepreneurs 15 minutes to show, grow, and let the world know about their small business. Today, I'm hustling with Dr. Caryn Phillips, founder of MomLife Health and Wellness in Medfield. As a doctor of physical therapy and pelvic floor therapist, Caryn helps women strengthen from the inside out through every stage of motherhood and beyond. Time to give the floor to someone who knows it best. Hey everyone, Evan Walsh here with Caryn Phillips, and today we're going to be featuring her business. Why don't you tell us a little bit about it and how you got started?
Yep, so I'm Caryn, and I'm a pelvic floor physical therapist and own MomLife Health and Wellness here in Medfield.
Yeah.
I actually grew up in Medfield as well. Our business, we're here to provide physical therapy services to women who are going through pregnancy, postpartum, and then anyone dealing with any pelvic floor dysfunction of any age.
Well, I have to tell you, when I walked in, it was just a beautiful entry that you have, and the setting and the space is very calming. So I feel very, very calm and at ease.
Yes.
So
one of my visions when opening my own practice was to not make it feel like a medical facility. We do some vulnerable work, so I wanted patients to feel as comfortable and safe as possible. So that's kind of the reason behind the homey,
well,
decor.
Job well done, and I feel very safe and comfortable. Give us an idea how you got into this, sort of what inspired you, and kind of where do you see yourself going in the years to come?
Yeah, so I've been a physical therapist for 15 years,
Wow.
and a pelvic floor physical therapist for 14 years. And up until 2019, I was working, I worked in a Boston hospital and worked for various other outpatient companies. And during that time, I kind of felt that there was this need to educate and create awareness around women's health and, prenatal, postpartum care that I wasn't seeing in the settings that I was in. Patients were coming years after they, started complaining about their symptoms because they were being dismissed from some of their providers, and there wasn't a lot of community education around this. So, in 2019, I decided that I wanted to kind of take it into my own hands and have the piece of caring for these women through physical therapy, but also a big part of MomLife is community education. We work with a lot of other local like-minded businesses to collaborate and do workshops and, fun events where people can learn kind of about pelvic health and their body during pregnancy and postpartum and make it a more normal conversation. Yeah.
So why don't you give us an idea as to what some of the symptoms might be for pelvic floor issues, and also what are some of the treatment methods or exercises and things that you can do?
Definitely. So I do think if people have heard of pelvic floor physical therapy, they usually think of bladder issues and Kegels. That's like a big word out there. But it is a lot more than that. Definitely if anyone is dealing with things that wouldn't seem normal as far as frequency of going to the bathroom, bowel issues, even low back pain and hip pain that hasn't resolved with traditional physical therapy or other modalities. Sometimes the pelvic floor can be kind of like that missing piece to the puzzle. And pelvic pain, we see a lot of patients who are either diagnosed or wondering if they have endometriosis. Yes.
Well, that's a good place to start. And I can understand, why people could feel uncomfortable, talking about that. I'm a bladder cancer survivor myself.
Oh, okay.
What is a message that you would have to people that either haven't fully investigated, getting into something like this for treatment and that kind of stuff, or things people should consider before they come in and talk with someone like yourself?
Well, these days there's more on social media. I think that has helped women become aware of these kinds of services. We try to be pretty present on social media just with education around, signs and symptoms, who might benefit from going to pelvic floor physical therapy. And also, I feel strongly that if someone feels like something isn't right, even if their provider tells them there's nothing they can do about it, to not really take no for an answer and continue to look into it, because there is help for some of these things that happen after you've had a baby, or when you're going into menopause, that you can get help for.
Oh, okay. So it kind of covers that
the whole.
Oh, interesting.
Yeah.
I'm just, this is new to me.
I can imagine, yes. Most people I speak with don't know a lot about it,
Well, this is good to get the word out there. So who would be a prime candidate for a pelvic floor treatment, or I don't know what you would call it?
Definitely, I feel strongly that if you're pregnant or postpartum, anyone would benefit from having at least one visit with a pelvic floor physical therapist, because we're assessing your body, your muscles, your joints, posture, all those things, but also have this special knowledge about the muscles that are in the pelvis, which are very relevant during pregnancy.
Sure.
And delivery and those kinds of things.
I think all your muscles are relevant. At least that's what my wife said.
Yes. So a orthopedic physical therapist is just not as well trained in pregnancy and postpartum and those muscles specifically. And I think learning about what your body is going to go through during pregnancy and delivery and afterwards is just more empowering to any woman.
Sure, to go in with the confidence, kind of, knowing all those different things.
Yes.
Good. Oh, that's great. I was very impressed with the space. You have a gym area over there. You have other areas and offices for consultations and such.
Yes.
How many people do you have here working with you or for you? And
yes. So in this clinic, there's myself and then four other pelvic floor physical therapists. Everyone here only specializes in pelvic floor, but also has an orthopedic background. So we are kind of looking at the whole body, trying to get to the root cause of what may be causing someone's symptoms. And then we have some lovely ladies at the front desk as well.
Sure.
And then, yes, I actually just opened a second location this
that's great.
Summer in Braintree. So now we're serving the South Shore. We have 3 physical therapists over there.
That's great. Congratulations.
Thank you.
What do you think? Obviously you're clearly an entrepreneur and growing, which is fantastic. What's been the biggest challenge for you getting started and kind of growing and that kind of thing?
I guess knowing where to start with, marketing strategies. I talk to a lot of people who are business owners now, and I think that getting out there and putting yourself out there when you're uncomfortable, making relationships with people, networking, putting yourself out there on social media.
Sure. Are you uncomfortable right now?
I a little bit, yes.
You're
I've done it
doing
a
great.
lot, but I still get uncomfortable.
I think the coolest part about social media is that you can have fun. You can do it in sort of fun and creative ways. What we're doing right now is sort of a fun and creative way.
For sure.
And my goal obviously is to get your name and reputation out there and
thank
spread
you.
it. So
appreciate it very much.
So what, that being said, do you have any advice for people other than getting out there, that somebody might benefit from if they're thinking about getting into business or?
That's honestly also probably my biggest piece of advice, because I do think it's made the biggest difference, being open-minded to collaborating with other businesses, thinking outside the box, not overthinking things.
Sure. Yeah, I always say it's better to just do it.
Yes.
And, don't worry about it being perfect, whatever it is.
Right. Better to be done than perfect.
Absolutely. Absolutely. Well, where do you see yourself going from here?
Well, opening a new clinic has been quite it's still a new big project. Yeah. So still working on that, but just continuing to hold, community events. We do community events in this space. We also do them in the South Shore, trying to create community for moms.
Yeah.
Also for like-minded business owners who kind of work in the same population as we do.
Yeah.
So just kind of growing the community
Yeah.
and continuing to get our name out there.
Yeah. Oh, that's great. That's great. If there was a message that you had to people that were thinking about, coming in and maybe trying out, some of the stuff that you guys specialize in, what would you say to those people?
Not to be intimidated or nervous.
Sure.
I do think that when people hear about pelvic floor physical therapy, they're like, what is that? Your comfort level is our biggest concern.
Mm-hmm.
So like I said earlier, I want it to be a safe place where people feel heard. So just giving a call. Our front desk is very knowledgeable to answer questions. We do 15-minute free phone calls with the physical therapist.
Oh, great. Okay.
So just, I guess taking that leap and taking the next step, because I feel like once people come, they are so glad that they did.
Yeah.
They wish that they came sooner.
Yeah.
Yeah.